Let's see about paracetamol. So paracetamol is a most commonly used drugs. So paracetamol, the available brand, Panadol, Calpol, Alvedon. So it is an analgesic and antipyretic drug that is used to temporarily relieve mild to moderate pain and fever, and it is commonly included as an ingredient in cold and flu medications and is also used on its own. So paracetamol, it is an analgesic and antipyretic drug. It is very important, analgesic and antipyretic drug. It is not clear exactly how paracetamol works. So however, it is thought to work by blocking chemical messengers in the brain that let us know when we are in pain, and by affecting the chemical messengers that regulate our body temperature. So but the clear mechanism is not known, but it blocking the chemical messengers. So paracetamol was first made in 1878 but only become more widely used in the 1950s. So today paracetamol is one of the most widely used painkillers in the world, and branded and generic versions of this drug is also available. So first it made in 1878. So the classification of the paracetamol, it comes under non-steroidal anti-inflammatory drugs, and it is a non-selective COX inhibitors, that is para-aminophenol derivatives. So paracetamol comes under para-aminophenol derivatives. So paracetamol is also called as acetaminophen. This category, the first introduced drug is phenacetin. So but this drug is banned because of it produces severe adverse effect. That's why we use paracetamol. It is a metabolite of phenacetin and it is safer and effective. So the first drug is phenacetin, but it is not used now because its adverse effect. So what are the actions? First one is analgesic and antipyretic and weak anti-inflammatory property, but it not give for anti-inflammatory drug. So due to weak PG inhibitory activity in the periphery, it has a poor anti-inflammatory actions. So why the anti-inflammatory actions are poor? Because it is weak PG, that is prostaglandin inhibitor activity. So paracetamol active on cyclooxygenase in the brain, which accounts for its antipyretic action. So in the presence of peroxides which are present at the site of inflammation, paracetamol has a poor ability to inhibit cyclooxygenase. So at the site of inflammation there is presence of peroxides. So there is poor ability to inhibit cyclooxygenase. That's why there is a poor anti-inflammatory property. It does not stimulate respiration and has no actions on acid-base balance. So acid-base balance and cellular metabolism, cardiovascular system and platelet function. So it is not a uricosuric agent and it produces gastric irritation is mild. So it does not stimulate respiration and has no actions on acid-base balance, cellular metabolism, cardiovascular system and platelet function, and it is not a uricosuric agent. So gastric irritation in paracetamol is mild. And what are the pharmacokinetics of paracetamol? Paracetamol is well absorbed orally and 30% it is protein bound. It is very important, 30% protein bound, and it is metabolized by the hepatic microsomal enzymes by glucuronide conjugation 60% and glutathione conjugation is 20%. So paracetamol is metabolized in the liver. That's why it produces most commonly hepatic failure, because it is metabolized in the hepatic microsomal enzymes. So it is 30% protein bound. These are the important points in pharmacokinetics of paracetamol. Next, moving on to adverse effects. So, in antipyretic doses, paracetamol is safe and well tolerated. Nausea and rashes may occur, and if we take large doses of paracetamol, it produces acute paracetamol poisoning results. So, adverse effects are nausea and rashes may occur. If we take large doses, it produces acute paracetamol poisoning. The children are more susceptible because their ability to conjugate by glucuronidation is poor. So, children, that's why we give smaller or little dose of paracetamol, and 10 to 15 grams in adults cause serious toxicity. 10 to 15 grams produces serious toxicity in adults. So, what are the symptoms? Nausea, vomiting, anorexia and abdominal pain during first 24 hours. If it produces toxicity, these are the symptoms. And nephrotoxicity, that is acute renal failure. These are the symptoms are caused due to toxicity of paracetamol. So paracetamol is hepatotoxic, is very important, is hepatotoxic and produces severe hepatic damage, that is liver damage, and manifestations seen within 2 to 4 days, and include increased serum transaminase, jaundice, liver tiredness and prolonged PT, that is prolonged prothrombin time. So paracetamol is hepatotoxic, is very important. And cause for hepatotoxicity. Why it produces hepatotoxicity? The small portion of paracetamol that is metabolized to a highly reactive intermediate, this compound, that is N-acetyl benzoquinone imine. So it is detoxified generally by conjugation with glutathione. So it's very important, the highly reactive intermediate product, that is N-acetyl benzoquinone imine. So but when large doses of paracetamol are taken, hepatic glutathione is depleted, and the toxic metabolite binds to sulfhydryl groups in hepatic proteins, resulting in hepatic necrosis. So if we take large doses, that it causes hepatic necrosis, and chronic alcoholics and infants are more prone to hepatotoxicity. It's very important. Chronic alcoholics and infants are more prone to hepatotoxicity. So this is the reason for why paracetamol most commonly cause hepatotoxicity. What are the treatment? Stomach wash is given. If paracetamol acute toxicity is present, first one is stomach wash is given, and activated charcoal prevents further absorption. An antidote for paracetamol is N-acetylcysteine, that is 150 mg per kg IV infusion over 15 minutes repeated as required. An oral loading dose is 140 mg per kg followed by 70 mg per kg every 4 hours and 17 doses. So N-acetylcysteine is an antidote for paracetamol toxicity. So N-acetylcysteine partly replenishes the glutathione stores in the liver and prevents binding of toxic metabolites to the cellular constituents. This is how N-acetylcysteine prevent the toxicity of the paracetamol. So it replenishes the glutathione stores of the liver. That's why it prevents the binding of the toxic metabolite to the cellular constituents. So what are the uses for paracetamol? So paracetamol is used as an analgesic in painful conditions like toothache, headache and myalgia, and used as an antipyretic. And if it is chronic pulpitis, periodontal abscess, post extraction, these are the conditions we used paracetamol with ibuprofen. These are the dental conditions. Most commonly we use paracetamol with ibuprofen. So it is used for the relief of headache, tension headache, migraine, backache, rheumatic and muscle pain, mild arthritis and osteoarthritis. So paracetamol is analgesic and antipyretic, and it is not a anti-inflammatory drug. It is very, very important. We have to remember that point. So toothache, period pain is also called as dysmenorrhea, and cold and flu symptoms, and sore throat, sinus pain, and post-operative pain, and fever, that is pyrexia. These are the uses for these are the conditions we are used paracetamol.